First of all, thanks to organizers for giving me an opportunity, and thank you, Ismail. What I am going to talk in next 15 minutes, that can intervention in childhood obesity prevent diabetes in adulthood. Childhood obesity and diabetes, you can say it's a two sides of same coin. And here you can see this photo. I'm sure you must have seen multiple times, but at the same time you might have seen many childhood or the children with acanthosis nigricans also with significant insulin resistance. My agenda for next 15 minutes will be, I'll be talking about childhood obesity, the relation between obesity and diabetes, the incidence of childhood obesity with adult diabetes, what are the intervention to reduce the obesity, and then there are some data to show benefits, and I will conclude. What's the childhood obesity? It is an obesity defined as BMI, as it is above the 95th percentile of the age for weight, and it's sex specific also. This I have taken from a pediatric supplements in 2007. The burden of childhood obesity, it is a rapid increase in prevalence of childhood obesity globally. In 2013, there is a 42 million children under the age of 5 were overweight or obese, which is WHO statement. And it has been first time ever a generation of children may have a shorter life expectancy at the time of their birth in compared to their parents, and this had come in a magazine in a time in 2014. The prevalence in India, which we had shown recently in 5 Indian cities from New Delhi, Jaipur, Agra, Allahabad and Mumbai, which had shown the prevalence of overweight was 14.4%, obese and 2.8% according to International Obesity Task Force profile. The further, there was a abdominal obesity was higher in the girl in compared to boys. There is one more study which had shown from 2002 to 2006, there is a significant increase in childhood obesity from 16% to 24%. This high prevalence was more seen in private school in compared to public school. Maybe upper middle class is more in the public school, in the private school in compared to public school, maybe because of lower socio-economic status, but still it is increasing even in the public school also. There are multiple studies from across the country, from North India to South India, and you can see from 2007 to 2014, we have data from 1990 to 2007 that had shown significantly this proportion of obesity across the country in across the school children. And this prevalence of obesity, if I just see from other Asian countries, even India is also catching up faster in compared to, it is almost comparable to other Asian countries also. The causes we all know about the childhood obesity, it is limited access to healthy, affordable food, and I am sure we had discussed about from Malaysia, Hong Kong, children study in all these. These are the all common problems. Advertisement of less healthy food, the greater availability of high energy and dense food, it is sugary drinks, less healthy foods on a school campus, lack of daily quality physical activity at school as well as at home, no safe and appealing place in many communities to play or to remain active, increasing portion size, lack of breastfeeding support, and television and media, they all are impacting the increasing the childhood obesity, and I'm sure all of you will agree for the same. But there are some socio-cultural myths also and misconceptions which are more prevalent in our country, that a chubby child is a healthy child. This is very important because the Indian condition, they feel that a child which is slightly obese may be a healthy child. The ghee, that is the normal local butter, they consider it's a beneficial for health. They feel the high fat food is good for the growth of the child. The priority for academics at the cost of playtime. So it is the school child has to move more for the academics, more for the education in compared to the playing, and at the same time the TV, computer and cell phone and increase the problem in our country, and which is also I'm sure all over the world the similar issues are also. Does childhood obesity track in adulthood? So this is the question, that whether the child who are obese in childhood, does it track into the adulthood? Yes, there are multiple papers and data to support it, and this very important study, which is a Bogalusa heart study, which has been compared the children, and after 12 years again when they were an adult at the age of 21, they had seen those children whose childhood BMI percentile was more than 95, you can see the significant increase in their body mass index at the adulthood is more than 30%, and this is a very, very significant increase. It means there is a direct correlation between the children who are having the BMI percentage, I mean the childhood BMI percentile, when it is more than 85 to 94 and more than 94, you can see these BMI with the adulthood at the age of 21 to 23, there was more than 20, I mean more than 30, as well as more than even 25 to 29.9. So they were more overweight and more obese adult. The tracking of childhood overweight into adulthood, there was a direct proportion. Even the percentage of the persons who were having more obese in the childhood, they were having more obesity at the adults. At the same time, there were more overweight in the children, they were also having overweight or obesity in children. So there is a all studies, which is this paper is actually meta-analysis of 25 papers, which had shown reported increased risk of overweight and obesity in youths to the overweight and obesity in adulthood also. Do metabolic abnormalities in childhood track into the adulthood also? So I mean, one side we are talking of the obesity which is in children goes also with the adults, but at the same time we wanted to know whether other metabolic abnormalities will they go also from the childhood to the adult. Yes, there is a tracking of CV risk factor from childhood to adult, and this paper from India which had shown the CV risk factor at the time of the age which was around 8, and when the same children were at the age of 21, and the adulthood when they had seen the BMI, the waist circumference, the blood pressure, these were all the higher percentile of these, even the triglyceride, fasting plasma glucose, as well as insulin resistance, and found to be have more when they were also adults. So that relative risk, and that was higher with the children who were having higher cardiovascular risk factor in childhood were having also in the adult. So the risk of an individual being in the highest risk category at the 21 years was increased if they were in the same category at the age of 8. So I mean the similar CV risk factor were there. These are the first data on child adult tracking a range of CVD risk factor from a low middle income country. So I mean this data from India was the first time this data was published from a lower middle income countries. These findings are consistent with the studies from high income countries also. So we have a paper similarly also from the higher income group countries also, and this suggests that there should be measures to reduce the factors in children, and it should be a public health intervention also. It's very important. The tracking of cardiometabolic risk factor, as I told you, the similar type of data and papers were there from all over the world, and these papers were suggestive of the similar type of data. The cardiovascular risk factors, those were at the higher percentile in the children, were also present in the adults when the similar risk was calculated, or CV risk factors or metabolic risk factors from adults also when compared. These metabolic phenotype in adult cardiac metabolic phenotype, I mean there are children who are metabolically healthy children and they are obese. Very few of them could remain metabolically healthy obese, but otherwise a metabolically unhealthy and obese children were having metabolically unhealthy adults, and they were also obese in their adulthood also. Does obesity in childhood increase the risk of diabetes in adulthood? Now that's a very important question which we wanted to know. So these were the compared when the same children were between the age between 3 to 18 years, and they were followed up to 29 years for, I mean, and then again when they were adult between 21 to 31 years, their fasting insulin and the BMI both were calculated, and what they found that insulin resistance was higher in those children who were between the age of 3 to 18. I mean they were having, and the similar data was also seen when they were in adulthood. So I mean the insulin resistance was very, very high, and the risk of developing obesity in the persons who were overweight children and they were obese adult was found to have highest incidence of IFG, ISGT, metabolic syndrome, as well as diabetes. And that was also, there were fewer also with the normal weight in the children also have, some of them had increased risk of developing diabetes, but it was more with the overweight children and obese children when they become the adult. And the childhood obesity tracks into adulthood, metabolic abnormalities in childhood tracks into adulthood, and obesity in childhood increases the risk of diabetes in adulthood also. So what we should, only the stopping the childhood obesity can prevent all these issues. But there is one more important and interesting issue of India. I mean, I'm talking of one very interesting, because it's not all the time childhood obesity is responsible for increasing the diabetes risk in adulthood. This is a New Delhi birth cohort study where the study of pregnancy outcome and childhood growth began from 1969 and several phases. There are 1492 subjects were re-evaluated at the age of 26 to 32. And you will be surprised, none of these subjects were obese at the age of 12 years. I mean, these were not the children who were obese, but these were they had gained, their weight gain was very high between 2 to 11. It means they were low birth weight child and they gained their weight more during that time. So even at the time of when they were at the age of 12, none of them were coming in an obese child group, but still they were having higher risk of developing diabetes in adult because these were the low birth weight children, and then they gained their weight more during the age between 2 to 11 and then found to become more diabetic in their adult. This is because of a fetal origin of adult disease, that is a Barker hypothesis. It is during early life nutrient exposure sets metabolic behavior and thereby determine the risk of chronic disease during the adult life. And this is because of a intergenerational cycle of malnutrition. What happens? A low birth weight baby comes. The low birth baby, child growth failure, again low weight and height in teens, a small adult woman, and which will make again a small maternal size. So this is the reason why they get intergenerational cycle of malnutrition, and which is also prevalent in our country. If these children catch weight early, they develop more metabolic abnormalities. So this is very important. And it was again published a very interesting paper from Yagnik and group from Pune, that is a Pune maternal nutrition study. The thin fat newborn phenotype resembles the adult Indian phenotype, which is a low muscle mass and central adiposity. So these were not the children who were obese, but these were the no birth weight children who developed who gained the weight in early childhood and then they become a low muscle mass and central obesity. In the first study in India specifically designed to examine the association of maternal diet and nutritional status in pregnancy with long-term metabolic outcome. And this is the life course: a poor start of life, intrauterine value, small for a gestational age, and offspring of gestational diabetes. There is a rapid growth in infancy, childhood, poor protein intake or poor physical activity within 2 minutes, sedentary lifestyle in adolescents, sarcopenia, adiposity, NAFLD. Young adults will come with a metabolic syndrome, insulin resistance, IGT, GDM, and older adult will come with NASH, type 2 diabetes, and coronary artery disease. So this is the ladder pattern with these children who were born small with the gestational age. The intervention to prevent childhood obesity I will not talk because everybody had talked about the same thing. The target is for India, I will say specifically pre-pregnant females, during pregnancy, lactating mothers and infants, from infancy to young childhood, children to adolescent, because they are catching up their weight faster. Even they may have a normal children they look like, but they are catching weight faster. That is very important. And young adults, they should be the target for the same. Intervention in childhood obesity: diet, physical activity, media-based intervention, parental involvement in screening time, and behavioral counseling is the most important thing for parents and children both simultaneously. It requires more with the parents also. This food pyramid I will not talk. Healthy balanced diet we had talked. The activity which we are promoting in India between the age of 6 to 11 years, which is very important. Never sit idle for more than 2 hours, because these are the children who are busy with their iPhones and TV. That is the most important thing. The healthy weight goals for children and adolescents, very important. Intervention, one study which is a MARG. So it will be a last slide which I will be taking. A MARG study is a medical education for children and adolescents for realistic prevention of obesity and diabetes for healthy aging. This is very important, and this is done for more than 40,000 children, for more than 25,000 parents, 1,500 teachers in 3 cities in New Delhi, Agra and Jaipur. And this paper was published in British Journal of Nutrition in 2010, and which had shown a significant change in the knowledge and behavioral scores. So it was primarily a behavioral therapy and knowledge scores for the school children, their parents as well as for the teachers. So being obese as a child increases the likelihood of being obese as an adult. Obesity in adult leads to obesity related complication, and one of important is diabetes and CVD. This review as related consequence of childhood obesity outlines the evidence for childhood obesity as a predictor of adult obesity and obesity related disorders, thereby emphasizing the importance of early intervention to prevent and the onset of child obesity in children. To summarize, childhood obesity is increasing rapidly all over the world. Almost 3/4 of obese children will be obese adults. Multiple CV risk factor clustering persist from childhood to adulthood, and which increases the risk of type 2 diabetes in adult. Early occurrence of complication will lead to increased burden of chronic disease even in youth. Childhood obesity needs urgent attention with multiple component intervention for prevention of adult diabetes and healthier new generation. Thank you very much. I welcome you all for our national meeting of Obesity Arrow at Aurangabad. It's a beautiful city in near Mumbai. And with this, I welcome you again for Arrow meeting. Thank you very much. Thank you, Ismail.